of sterilization began in 1933, when the American Sterilizer Company, later called AMSCO, and now part of the STERILE Corporation, developed the first steam sterilizer that allows temperatures to be measured using a thermometer. The American College of Surgeons is credited with the birth of sterile processing. That organization recommended standardization of surgical dressings and centralization of the preparation and handling of all surgical supplies into one unit, therefore called central supply. The sterile processing department is defined in Perkins in 1982 as that service area within the hospital which processes, issues, and controls professional supplies and equipment, both sterile and unsterile, for all departments and units of the hospital for the care and safety of the patients. In 1944 through 1945, W.B. Underwood performed extensive studies of sterile processing, and his work established a philosophy of centralization which has proven to be invaluable. In the early days, when there were comparatively few surgical cases, medical devices and supplies were sterilized primarily in the operating rooms between cases. Operating room personnel were considered to be the most knowledgeable about sterilization. As the number of surgeries increased and the ORs became busier, sterilization was relocated to a workroom within the OR, and the OR supervisor monitored the processing. Surgical dressings, needles, syringes, and surgeon gloves were all prepared in this room and then distributed to the various departments within the hospital. For many years, sterilization activities were also performed in the areas where the items were used. For example, the nursing units, the nursery, and the labor delivery. It was difficult to monitor and standardize the sterilization process because each department had its own policies and procedures. In 1982, Dr. John Perkins, a scientist employed by AMSCO, observed that sterilization is everyone's business, but no one's responsibility. He advocated the centralization of processing in one department so that all procedures could be standardized. Sterile processing departments are typically divided into four major areas to accomplish the functions of decontamination: assembly and sterile processing, sterile storage, and distribution. The sterile processing department, central supply, or sterile supply, as it is also known, comprises that service within the hospital in which medical, surgical supplies, and equipment, both sterile and, are cleaned, prepared, processed, stored, and issued for patient care. Until the 1940s, medical surgical supplies were, for the most part, processed and maintained in the departments and patient care areas in which they were to be used. Under this system, there was considerable duplication of effort and equipment, and it was difficult to maintain consistently high standards for sterilization technique and product quality throughout the health care facility. A deeper look. Central to almost every healthcare space, much revolves around the efficiency and organization of the central sterile processing department. Often these departments serve on and off campus buildings, and employees need to be several days ahead of the surgical departments they supply. In a hospital setting, SPD is usually divided into separate areas according to the functions performed within each area. These areas can include, but are not limited to, the following: the decontamination area, where soiled items are received and cleaned. In a hospital setting, there might be a dedicated elevator or dumbwaiter used to transport the contaminated items from the OR or L&D, labor and delivery, and or nursing units to the SPD decontamination area. If there's not a dedicated system, a transport method might be developed for the safe transport of contaminated items from the using department to the decontamination area. The preparation and packaging area, where clean items are inspected, assembled, and packaged. This area is often within the sterilization area, but it could be separate and distinct. It may also be called a clean workroom. The high-level disinfection room or area, where clean items are high-level disinfected and then passed through the preparation and packaging clean area of the department for storage. The sterilization area, where terminal sterilization is performed. There might be a separate sterilization room or an area for ethylene oxide sterilization. There also may be a segregated area for holding steam sterilizer carts after they've been removed from the steam sterilizer to permit cooling of items away from high traffic areas. The sterile storage area, where sterile items are stored until needed. This area is used to store sterile items received from outside vendors, sterile items processed on site, or both. The location of the area where sterile medical surgical supplies are stored and distributed varies within the facility. Sterile stores, where items for patient care from outside manufacturers are stored. This area may be a completely separate area, or it might be within sterile storage area, depending on the size of facility. Sterile stores is sometimes referred to as a medical supply distribution, central supply, or a similar designation. The case cart area, where sterile supplies, trays, and/or sterile items from outside manufacturers are kept and picked for surgical cases. This area might be within the sterile storage area. Dispatch. This is where sterile and clean items are dispensed. There is usually a window through which the items are dispatched to the transporter. The loaner area, for the receipt and return of instruments borrowed for specialty procedures. Although such an area is not a requirement, many sterile processing departments are now providing a separate room or space for loaner instruments. Patient care equipment cleanup area. This is where patient care equipment is cleaned and disinfected. There may be a separate area designated for this purpose. There is usually a separate area for storage of clean and disinfected equipment. Depending on the facility, sterile processing departments can provide a variety of services, including decontamination, preparation and packaging, sterilization, and supply distribution. Regardless of the specific scope of its work in a given facility, the sterile processing department is responsible for providing dispensable, dependable, reliable service to enhance the quality of patient care. In other words, instrument sets, patient care equipment, and other medical devices must be processed and distributed in an accurate and timely manner so that the patient is not adversely affected. The important work performed in SPD permits surgeons to perform surgery and patients to heal. It has been said that the department is the heart of the hospital. Any healthcare facility would find it difficult to function even for a few hours without the sterile processing department.